Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. Today I welcome Jillian Olmstead. Nice having you here.
It's good to be here.
Now you are a PharmD and you are currently a pharmacist working at Peninsula Regional Medical Center. And you came in today to talk specifically about medications that we use for pain relief.
Yes.
And we know this is a huge segment of the market for medications, and of course over the counter we can access many of these medications. But I think we're going to start out with opioids, which are the ones we need a prescription for, and of course we know we have a problem in this country with opioid abuse and so forth. But let's start off with opioids and what they're used for, and what is judicious use of opioids.
Yeah, so our opioids, they're going to be our class 2 scheduled drugs, so we tend to guard them a little more closely than we do our NSAIDs or our Tylenol, which, like you mentioned, are over the counter. We tend to use these for more severe pain, sometimes for more chronic pain as well, such as like cancer pain that's not necessarily treated very well with our NSAIDs or our Tylenol.
So what are some examples of opioids? And of course many of these are used primarily in the hospital for more significant pain relief, and they're given intravenously versus by mouth.
Yeah, so some of our intravenous opioids that we use are morphine, which is also available orally, and we'll see that used in the community. We can also use fentanyl and hydromorphone intravenously. We try not to use those as much, but for our patients who might have like a morphine allergy, they tend to be a little bit safer for them because there's less cross-reactivity. But our hydromorphone is very potent. We really try to minimize that.
What's the brand name for that?
That is Dilaudid.
Okay.
Sorry. That one's also available by mouth as well, but like I mentioned, we really try to not use that unless we have to.
I know we used to hear a lot about Percocet, and that's a combination drug, and we're going to talk about Tylenol in a little bit, but it's a combination drug involving Tylenol.
Yes, we'll often see our combination drugs like our Percocet or our Norco, which is hydrocodone and acetaminophen, versus Percocet is oxycodone and acetaminophen. We'll see those sometimes out in the community setting. We try not to use those so much in the hospital. We'll try to stick to just one drug instead of combination products, just so we can keep track better of how much Tylenol and how much opioids we're using for those patients. But they are still available out in the community, and people still do use them.
So by far morphine's the most commonly used, followed by like oxycodone, hydrocodone. I know we don't use meperidine or Demerol much anymore because of the abuse potential and how it's broken down. But tell us how opioids in general act in the body.
So opioids work on the mu receptor, which is in the brain as well as in the gut. So in the brain, it works really well at helping to control pain. So your body releases endogenous opioid type molecules like your endorphins and your enkephalins that act on that mu receptor, and that helps to control pain naturally. But our opioid analgesics that we give to patients, that's an extra boost to help control pain. Whereas in the gut, when it works, it causes some constipation, which is why that's one of the number one side effects that patients complain about.
Absolutely, and especially if you need to be on it chronically, you need a medicine to help with the constipation issue, because that's a big side effect problem. What other side effects can there be?
So aside from the constipation, we can see respiratory depression. Usually that happens with a much higher dose, and our patients will struggle to breathe. That's why sometimes our patients that have asthma or COPD, we're very hesitant to give them higher doses of opioids if what they're currently on is not controlling their pain. And it can also cause some CNS depression, which results in like drowsiness, patients not being very arousable, which is one of the really concerning side effects that we watch for in the hospital to make sure we're not overdosing our patients.
All these types of drugs, we have to be careful in older adults because of that, and the risk for falls and things like that.
Yeah, so our older adults, not only can they see maybe some more constipation, but they're also much more susceptible to having those analgesic effects and the CNS depression, which is why they're at a higher risk of falls. So that's why it's always important with our older adults that we start at the lowest possible dose and increase it as needed to, make sure that we're treating them appropriately, but we're not overdoing it.
Right, and that goes for all opioids, I guess, in most cases. Just keep them on a minimal period of time because of the addiction risk. All right, let's move on to the medications that people can purchase over the counter and take it home as they would like sometimes, or they're prescribed by a physician for some sort of mild to moderate pain relief. So shall we start with acetaminophen or Tylenol?
Yeah, so Tylenol is great. It works to help control your more mild pains. It's also very helpful in our patients that have like bone pain, like osteoarthritis. Taking it as needed in that instance is not going to be the best. It's not going to be very effective. But if you take it on a schedule, so you take it every 6 hours as either your physician prescribes, or you take the 650 milligram tablet or 500 milligram tablet every 6 hours, then that'll help get ahead of the pain, and it'll cover it much more effectively, particularly in our osteoarthritis patients.
Right, versus if you have a headache or something, you're taking just a one-time dose usually.
Right, you'll just take a one-time dose and it should start to work in 30 to 60 minutes. And usually it's enough to cover most patients.
And how does Tylenol work?
So Tylenol, its mechanism of action is not entirely known. There's some thought that it works on the cyclooxygenase enzyme, which is very similar to our NSAIDs, which we'll talk about later. In Tylenol in particular, it's thought that it works on the cyclooxygenase enzyme in the brain to inhibit it, which is why it's really good at treating fevers and taking care of pain. However, it's not very good for inflammation. So if you've got like a swollen joint or something like that, Tylenol's not going to be your best option.
Be better to do like the Motrin, the NSAID, and we'll talk about those in just a minute. I know there's a fairly new development with Tylenol. There's an IV form that we see used in the hospital for pain management. Tell us a little bit about that.
Yes, so its brand name is Pharm, and we see it often used in our patients that are coming out of surgery. So they go for like a hip or a knee replacement or a shoulder replacement, and we'll use IV Tylenol around the clock for the first 24 hours or so to really get ahead of their pain and help control it, and then we'll transition them to the oral Tylenol that they can continue throughout their stay and then when they go home as well.
Now, is that a way to minimize the use of opioids to some degree?
Yes,
definitely. It's effective in that way?
Yes, it is.
So that's a huge development, I imagine.
It is. It's great for pain control, so we get to minimize our opioid use. And then Tylenol, for the most part, is very, very safe. So it's a good, effective use of our pain control for those patients.
Well, let's talk about one thing we do have to be concerned about with Tylenol, and that's damage to the liver. And people have to be very careful with the dosage. So what are the guidelines regarding that?
So when you take it outpatient, not under the supervision of a healthcare provider, it's recommended that you limit the total daily dose to 3 grams or 3,000 milligrams, because I know Tylenol usually comes in milligram tablets. It doesn't come in grams. So you have to limit it to 3,000 milligrams per day. And it's super important to keep track of all of the products that you're taking over the counter and prescription, because Tylenol is hidden in a lot of various things. So if you're having some cough, cold symptoms, a lot of those products have Tylenol hidden in them. So you always have to look and see on the drug information slip on the back of the box or the packaging, does it have acetaminophen in it, and see how much is in there, see how much you're taking, and make sure you calculate out how much total you're taking.
I know that's one of the reasons they're trying to get away from those combo products in the hospital, because people were taking them, and then they were technically taking way too much Tylenol per day because of those medications.
Yeah, and with those combination products, it's so easy to forget that there's extra things in there. Benadryl is not by any means a pain reliever, but that's hidden in a lot of products as well, and that can cause drowsiness. So it's always important to look at your combination products and make sure you know what's in them, and what is in them is something that you're taking for a reason. So if you're not having any pain, try to find a product that doesn't have Tylenol or any other analgesic medication in it.
Okay, very good. I know we should probably briefly mention aspirin, even though these days we don't use aspirin much for pain anymore. It used to be one of the few things we had. Now aspirin's used for stroke and heart attack prevention, and not so much for pain. And why is that?
So aspirin for pain control, you're right, it did used to be one of the few options that we had. But in order to have adequate pain control with aspirin, you have to take much, much higher doses. And when you take those higher doses, you're at a higher risk of having any sort of bleeding, whether it be in your GI tract, which is very common because you've got those enzymes that aspirin works on in your GI tract, as well as, additional bruising and things like that.
Yeah, I know it's really high risk for older adults because of the GI bleeding, and they can easily become anemic and not even know it. So we have to be very careful with aspirin, even when it's used for heart attack prevention and such. They need to be followed by a doctor and only take it under the prescription of a provider.
Right, and we try to use the lowest dose possible.
The baby aspirin,
Yep, the 81 milligrams.
Okay, so let's move on to a class of meds that is used quite a bit for moderate pain relief, and that would be the NSAIDs. And what that stands for is non-steroidal anti-inflammatory drugs. And of course, I think most people know these as either ibuprofen or Motrin. And then of course there's naproxen, which is Aleve. There's a few others, but let's talk about those because they're used quite a bit.
They are. They're very good. They also work for your mild pain if, Tylenol's not really doing the trick, but they also work well for moderate pain. And like I had alluded to before, if you've got some sort of inflammation, they're one of the over-the-counter medications that you should go to if you're trying to use medication to help alleviate that. Yeah.
So for some mild arthritis or, things like that, and is it you should take it around the clock per se if there's an issue of that nature versus just a spot dose here and there?
No, you should definitely try to minimize how much you're using. Tylenol, I would definitely say use it around the clock, but not for inflammation. But your NSAIDs, you want to be judicious with how much you're using. Just take it when you need it. If you feel like you've got this massive headache that's not going away, you take your Motrin or your Advil, and it covers it, and it's only going to last for 4 to 6 hours. If you come to that 5-hour period and you start to feel those symptoms creeping back up, then you can redose yourself in an hour. But I would definitely not take it around the clock.
So how do they work exactly, and then why do we have to be so judicious? They have some side effects.
Yeah, so they work similarly to Tylenol, like I had mentioned, or acetaminophen. They work on the cyclooxygenase enzyme, and they just prevent the production of prostaglandins, which are an inflammatory marker in the body that increases when you've got any sort of damage or injury. And that's going to cause your inflammation. That's going to signify to your brain that there's some sort of pain that needs to be addressed by your body. So they're going to block the production of those and help to mediate that pain response that your body's going to have.
So the side effects would be that we're concerned about.
So with the cyclooxygenase inhibition, it also, similarly to aspirin, will decrease your, it inhibits your platelets. So you are at much higher risk of bleeding if you take them regularly.
And are they too hard on the stomach? We need to be careful.
Yes, depending on whether you've got a history of gastrointestinal bleed or not, your physician might actually recommend you either avoid them or you take them with a proton pump inhibitor like omeprazole, or I think the brand name is Prilosec. You can join those forces to try to cover yourself, but if you can get away without using them at all, that's probably best. And for our patients who have a history of like a heart attack or a stroke, or even renal dysfunction, it's really recommended that or kidney disease, it's really recommended that you do not use your NSAIDs or like your Advil, Motrin, because they can lead to water retention, which can increase your blood pressure and cause more damage, not only to your heart and your brains, but they're also very difficult on your kidneys as well.
Well, with regards to the stomach issues, is it better to take them with food?
Yes, absolutely. You can take them with food. Some people take them with milk if they don't want to take a full snack or a meal. That's perfectly fine as well. Just as long as it's with a full glass of water, you can always, increase the caloric content to match what your mood feels.
Okay. Well, like I say, these are used all the time. People just buy them and use them freely without even consulting their physician. And, you need to be careful. So I think we need to stress that. Don't go overboard with these things. If you're having pain that is not going away with some use of these medications over the counter, then you probably need to give your doctor a call, your provider a call.
Definitely. They can be very difficult on the body. while working at the hospital, I've seen a few cases of patients who have just had pain that wasn't controlled, and instead of seeing their provider, they just kept taking their Motrin or their naproxen, and then they would come to the hospital and we would find out that they had some sort of acute kidney injury where their body wasn't producing enough urine, and it's likely due to that, the NSAIDs. So you really need to be cautious when you're using them.
Any other pointers you'd like to end with? I guess we should just emphasize about the Tylenol and the liver and being careful with the dosing. And of course talking to your provider too and being alert that even though medications are over the counter, that doesn't mean they're completely safe and have no side effects. You still have to be careful.
Absolutely. So Tylenol, like I mentioned before, it's always important to make sure that you're not taking more than those 3,000 milligrams a day. When you go over that, that's when you start to have that that liver toxicity that you had mentioned. Your liver is going to be the organ that metabolizes the Tylenol, but not all of the metabolites of the Tylenol are good for the body. Some of them can be pretty toxic. So when you take more than what you're supposed to, or even what you're supposed to, and say you're drinking alcohol as well, that can cause more buildup of those toxic metabolites, and that can be very dangerous to your body. So it is recommended, if you are going to drink less than one alcoholic beverage with Tylenol, I personally would not recommend any, but the package insert does say one is okay.
One drink is fine?
Yeah.
And of course you mentioned the importance of knowing about these combination products, all the ingredients, not just the main ingredient. There's other things mixed in these that you need to be cognizant of.
Definitely. I mean, like I mentioned, cough and cold products are notorious for having 3 or 4 ingredients in them, so it's always important to look on the back of the box, see what is in there and why it's in there. They'll always list, what medication, and then the indication should be listed next to it on your over-the-counter products. So if you see it's got some Tylenol and you're not having any sort of pain, choose something else.
Well, a lot of those liquid cold medicines have alcohol in them too.
Definitely.
So you have to be careful. So, well, thank you so much, Jillian, for being on the program and giving us an overview of these commonly used but important medications.
Well, thank you for having me. It was great to help shed some light onto our over-the-counter pain medications and opioids.
And thank you for joining us for this edition of Focus on Health here on PAC 14.